Hi, my name is Janis. I am BSc Sports Rehabilitation with Strength Conditioning student, and today's topic of my video will be LCS, which stands for Lower Cross Syndrome, and my video will consist of three parts. In first part of my video I will explain what Lower Cross Syndrome is, what are the most common root causes of LCS, physiology. In second part of the video I will talk about anatomy, and also I will demonstrate how you can examine LCS. And finally, in the third part of the video I will advise you on methods of treatment of this particular syndrome, and I will also demonstrate exercises which will help you to improve on muscle imbalances. Lower cross syndrome is a pattern of over and underactive muscles in both front and the back of the hip joint. In this case, cross refers to overactive or tight muscles, which in this case will be hip flexors and thoracolumbar extensors, with crossing pattern of underactive muscles, which in this case abdominals and glutes muscles, which creates this crossing pattern as you can see from the screen. So the question will be, what are its causes? Unfortunately, most of our life we spend sitting and being underactive, especially these days when we are all more dependent on modern-day technologies. People spending a lot of time checking their social media pages on their phone, on their notebook, PC, or when we're coming back home we are relaxing and watching telly, and that means more time we spend sitting. Also it could affect athletes as well, for the same reason I've just mentioned. Another reason could be due to their sport specifics. They could spend a lot of time on the court, on the pitch, in a position which could lead potentially to muscle imbalances. Muscle tightness is a primary reason for muscle imbalances. So the central nervous system causes muscles to contract, and it's also sending muscles as signals, and one of these signals could be to get muscle tight. So on this slide here I have two examples where you have two joints and agonist and antagonist muscle, and on the left hand side is a well balanced muscles and a joint example, and on the right you have unbalanced muscles. And so what's happening here when the central nervous system tells agonist muscles to get tight, its opposing muscles, antagonist, gets inhibited or switched off, and as a result of this action the joint gets stressed due to unbalanced forces, which further causes a compensation or incorrect movement pattern. Now let's look into anatomy of lower cross syndrome. There are two groups of muscles, and I call them group A and group B. So group A are the overactive shortened and tight muscles, and group B are underactive lengthened and weak muscles. So in group A there are muscles such as hip flexors, and these are psoas, rectus femoris, tensor fasciae latae. Then we have adductor complex muscles such as pectineus, gracialis, adductor longus, adductor magnus, adductor brevis. Hip muscle, iliopsoas, back muscles, latissimus dorsi and erector spinae. Lower limb muscles, gastrocnemius and soleus. Group B muscles, glutes maximus, glutes medius, glutes minimus, transverse abdominis, internal oblique, all core muscles, lower limb muscles, anterior tibialis, posterior tibialis, and vastus lateralis, vastus medialis. So neurologically, group A muscles shorten, and anteriorly these muscles tilt pelvic ball, creating excessive lumbar lordosis. So meanwhile, group B muscles connecting the abdominals and glutes muscles. And core support is lost as the weakened rectus and transverse abdominal muscles are overpowered by the pull of the strong ellipsoas and erector spine groups. The pattern which I just described creates lower cross syndrome asymmetry. Now I will show you the muscles I was talking about previously, and I will use a human biodigital program for that. So I will start with group A muscles, and it will be hip flexors. So first one is psoas major, rectus femoris, you can see it better now, and tensor fascia latae. Adductor complex muscles, and first one is pectineus, adductor brevis, adductor longus, gracialis, and adductor magnus. Back muscles, and the first one is iliocostalis lumborum, longissimus thorax, and also we have latissimus dorsi. Lower limb muscles, gastrocnemius, and soleus. And that's all for group A muscles. I've showed you the most common muscles affected by lower cross syndrome, and we will look now into group B muscles. Okay, now I will show you group B muscles, and I will start with glutes muscles. First one, glutes medius, glutes maximus, and glutes minimus. Now we're looking at abdominal muscles, and first one, external oblique, rectus abdominis, and internal oblique. Now we're looking at abdominal muscles, and first one, external oblique, rectus abdominis, and internal oblique. And then we also have tibialis anterior and tibialis posterior. And then we also have tibialis anterior and tibialis posterior. Okay, now I will be talking about PHE test, which stands for prone hip extension test, and it's clinical test which was originally developed by Vladimir Yanda. So what we're looking to do is to have our patient lying in prone. Spine should be in neutral position, hands by the side, legs in neutral position as well. The four muscles we will be looking at is gluteus maximus, hamstrings, contralateral erector spinae, ipsilateral erector spinae. Okay, now I will demonstrate how it works. So first we will be looking into a hip muscles, and then we look into spine muscles. So if we will ask our patient to extend the hip slowly, you palpate on the gluteus muscle and you palpate on the hamstring muscles. If you go slowly down, relax. If you extend your hip once again for me, and you can see by palpating which muscle activates first. So gluteus muscle should activate first, following by the hamstring muscles. Alright, if the hamstrings are dominant, that means that it's incorrect pattern. Now we will look into spine muscles. Again, I will ask my colleague to extend the hip. You palpate again on contralateral side of the spine, and on the ipsilateral side of the spine as well, and contralateral side should activate first. Okay, if you go slowly down again and extend your hip for me once again. And if you go down. Okay, I repeat again. The first muscles that should, or the correct pattern of activating muscles will be gluteus maximus first, hamstrings, and spine muscles which activate first contralateral spine, ipsilateral spine. The method I recommend to correct lower cross syndrome originally was developed by National Academy of Sports Medicine, and it's called Corrective Exercise Continuum, or CSC. It consists of 4 phases. Phase 1, inhibit, following by lengthening. Third step is activation, and the final step, integrate. So let's break it down. In phase 1, self-myofascial release used, or SMR techniques, and SMR techniques used on the areas which has been identified overactive or shortened through the assessments, and if SMR used correctly, it will reduce tension in the muscle. Following SMR, the second step is starting stretching or lengthening phase, and in combination with SMR, lengthening techniques will allow to restore optimal length of the muscle. In phase 3, focus is on activation techniques, and we will be working on the muscles which are underactive or weakened. For this step, isolated strengthening or positional isometric exercises recommended in order to improve intramuscular coordination. So the progression for the next step is once you feel comfortable with new optimal movement patterns. The fourth and the final step of corrective exercise continuum is integration. And this step is focusing on reintroducing dynamic movements. And once muscles being lengthened and strengthened, dynamic and body weight exercises will allow the nervous system to properly activate all the affected muscles. And next part of the video I will demonstrate exercises which will be appropriate for each of these phases. Okay, the first step in corrective exercise continuum is self-myofascial release. And you need to be working on the muscles which have been identified as overactive. We'll demonstrate the first exercise. As you can see, my colleague lying down face down. And you need to place your thigh over the roller, flexed and abducted. And then you can ask your patient to roll until you find the most tender spot, and you then need to hold for 30 to 90 seconds until that discomfort is reduced. The second exercise I will recommend for part 1, self-myofascial release. We will be working on TFL muscle. And as you can see, my colleague lying sideways with a roller in front of the hip. The top leg crosses the lower leg and stays on the floor. And what you need to do is slowly roll towards the knee joint, up and down until you find a tender spot. And once you found the tender spot, you need to hold for 30 to 90 seconds. Until you feel that discomfort disappears. Okay, the second step in corrective exercise continuum is static stretching. So now I will demonstrate a couple of simple exercises which you can do. So you need to be lying on your back, as my colleague. One leg will be flat on the ground. The other leg you're bringing up towards your chest with the help of your arms, and you're trying to bring a knee towards your chest, holding this stretch for 30 to 45 seconds. And then from the same position, and this will be the second stretch, you bring your hip across the other leg using the other arm, and you're trying to bring your knee down towards the ground, holding this stretch for another 30 to 45 seconds. And you can then repeat this pattern 2-3 times through. And the muscles which we are stretching here are the glutes muscles, glutes maximus, minimus. Right, the muscles that we are stretching here are the glutes muscles, glutes maximus, minimus and medius. Then we also stretch iliocostalis lumborum muscle, iliotibial band and tensor fascia latae. Okay, the third phase in corrective exercise continuum is the strengthening phase, and I will demonstrate the exercise which will help you to activate your glutes, hamstring complex as well as your abdominals. So you need to lie down on your back, arms by the side. Your legs should be bended approximately 45 degrees. And from this position, you need to push through your heels and come up. Hold it, exhale, and then you slowly go down, back on the floor. Inhale again, slowly go up. So you can repeat this exercise do 3 sets of 10 to 15 reps. Okay, can you just demonstrate for me once again? Okay, once the muscle's been inhibited, lengthened and strengthened, it's time for step 4, according to corrective exercise continuum. And it's time to reintroduce integrated dynamic movement. And in this stage, total body, multi-joint exercises will be appropriate for this stage. So the exercise I will recommend is TRX assisted squats. The TRX is used here to assist and control the movement. So before you initiate the movement, make sure that your back is neutral and straight. Core needs to be engaged. Your feet should be approximately shoulder width apart. Once you initiate the movement, you go approximately down to 90 degrees hip flexion. And if you go up, please, for me. Repeat the movement slowly. As you go into 90 degrees hip flexion, hold for a second and go up.